So we have a good idea of what the benefits and challenges are for PBC, but what's been achieved? I would say a lot's been achieved, but it's not just up to me. What do you think?
We're now into the third year of practice-based commissioning, and there have been some wins. We've learned a great deal. Obviously, we're refining a lot of processes. We're learning to work together better. We've now got more tools to enable us to make decisions. We're getting more data from the PCT, so therefore, in the future, hopefully we'll be able to make even bigger changes.
The other thing to say, from the patient's perspective as well as new services, it's been quite interesting interacting with the Students' Union, which is our patient representative body, and we felt we developed a really good rapport with them, and they've started to get a feel of the health challenges and how the NHS works, and that's something we hope to build on in the coming years.
What I'm most proud of is that having a dietitian in our cluster who's looking after for obesity and diabetes, our being a city centre cluster, there's lots of Asians involved or ethnic minorities involved, and I thought this is one of the needs of our localities.
I would probably say the fact is that we're getting good communication amongst the practice cluster team, and that we're doing annual reports and annual business plans, getting everybody involved in that. And practices have taken on board some of the incentives. We've got them to actually work on their business plan, and they're achieving them. Getting the majority of practice involved with that. So I think these are all pluses in practice-based commission. The fact is people are getting involved alongside their normal jobs.
We've done a lot of work with sexual health services here, bringing services out of genitourinary medicine here, and we're very pleased, and that's also helped GUM medicine hit its 48-hour targets. Equally, in parallel with the increasing access to primary care psychological therapies, the development of primary care mental health services has been a real bonus. Being able to get access to cognitive behavioural therapy for our patients is a real boon from that point of view.
I think the greatest incentive to me is the fact that, again being an ex-paramedic, is the fact that I can see an improvement in the patient's care, and that's my main, because I'm very, very keen on seeing the patient benefit from it, and I think that is happening gradually now.
I was on one of the treadmills, just going like, you know, like we do, and the girl outside of me, she was only about 25, and I'm not kidding, I think she was in a marathon.
The standards are better. They are offering more treatment at surgery level as opposed to going to hospitals.
For a long time I wanted to have physiotherapy, but I know that it was a precious commodity on the NHS, and I know that my doctor don't usually recommend it, and I was surprised the day when I went in and a small notice said you can access physiotherapy by yourself, you know, personally. So I took the number and I called, and then I had the forms, filled them up, and I was called in.
My involvement has been working as a senior physiotherapist on the self-referral to physiotherapy pilot that's been running from 2008 to 2009.
Yes, that's 7.
The benefits of the self-referral pilot for patient care is that it's empowered patients to take ownership of their own care, so they can access our service rather than going and seeking their GP. And I think many patients feel that they don't want to waste GP time by going and see somebody, you know, for their knee. They may as well go and see a physio directly. And so what we found is that it's improved patient compliance. They're more likely to attend their physiotherapy appointments. Last month we found that DNA rates for self-referral patients was less than 1%, whereas in comparison GP DNA rates was nearly 20%. So there's a big disparity between those two.
I didn't know that just back pain could affect so many parts of your body. I'm walking better, I'm walking longer, and I'm hardly in any pain. And normally I would just sit and mope and take pills. I haven't taken any since January.
I've been involved in developing direct access MRI for the lumbar spine and knees for primary care. This started back in June 2007 when Hugh Porter and Jonathan Hart approached us asking that we try and develop those services so that we can provide better services to patients. And I have to say it's been a very positive experience working with them, working with colleagues in primary care, basically doctors in primary care and secondary care, working together to develop what is now an established and really effective service.
What I'm most proud of is seeing how the GPs have embraced the pathway redesign and how they've worked so hard in developing some of the local projects that we've done. Direct access physio, direct access to diagnostics. So I would say I'm most proud of the GP's achievements.
I worked on the direct access endoscopy services where a gastroscopy was provided for patients with relevant history, and also a service where patients were provided with a flexible sigmoidoscopy for rectal bleeding with an opportunity to have hemorrhoid banding.
Kate's a healthcare assistant. I have your
overall, the benefits for the patient would be the fact that they would have reduced outpatient visits, improved patient information, and quicker access to a procedure, and then overall quicker access to a diagnosis. It's opened my eyes in terms of the difference in commissioning processes, and it formed good relationships in terms of we developed a protocol together and we agreed the pro formas we used within the project, and overall it went very well.
I'm a cognitive behaviour therapist. The city cluster, the GP cluster that I'm representing, have commissioned me directly to see patients for them rather than wait to send them to a specialist kind of unit and everything. So benefits for the patient is that the patient is seen quicker and they're also seen more locally as well. So there's more access for patients to specialist services.
I think the biggest achievement I've seen since I started here in PBC has been the direct access pathways. GPs in Nottingham City have redesigned pathways to diagnostics for patients. So things like MRI for knee and headaches, and also endoscopy. It means that the patient journey is a lot shorter, a lot better for the patient, and that's all been implemented through PBC. So I think that the GPs in Nottingham City should be very proud of that too.
There are hundreds of patients in Norcom that have benefited from the services that we've commissioned, and I'm thinking particularly of pelvic ultrasound and physiotherapy services, and those patients have benefited from decreases in waiting time, increased choice and improved access to those services.
It's really good to see some of the services that Norcom is developing. We're looking to take health checks out into a community setting so that we reach some of the people that maybe don't normally go to see their GP. And we're also looking to commission services to help people with mental health problems lead healthier lifestyles.
It's actually been very positive. I've thoroughly enjoyed that relationship. It's been very effective. And I think that the key thing has been that the doctors have identified the medical needs. They've been supported, particularly in the primary care team, by very effective management who've helped us bring to fruition a project over actually a very short period of time.
The GPs want more people on the boards. They are keen, or my group are, keen to have more representatives down at the surgery level, which didn't exist. And it's going to be a long-term process, but we're on the right track.
On the evidence of the experience that we've had so far, the prognosis is bright.